You may have heard about people talking about plate and screws as a way of fixing a fracture, but did you know that there are actually 5 different modes in which a plate can be applied? These are compression mode, neutralization mode, bridging mode, buttress mode, and tension band mode. In this video I'm going to explain the 5 different modes of plating, and for each mode we are going to talk about the effect that the mode has, the use case, and how that is achieved. But first of all, what do we actually mean by a mode? So basically, if we go back to this slide and we see that there's all these different plates, a plate is just a metal sheet with holes and with screws that are put through it. So that's a plate and screws. But the way you apply it in relation to the fracture and the way you put the screws in affects what it does biomechanically. So the mode is basically, what does the plate actually do for the fracture? Let's start with compression mode plating. So this is a radiograph of someone's right distal forearm, which shows 2 plates. And these are almost certainly in compression mode. So the effect of a compression mode plate is to cause interfragmentary compression. So you imagine a fracture line here, somewhere sort of halfway through the plate, between these 2 clusters of screws. And what this plate does is it compresses those 2 fragments together. And the use case of a compression plate, or a plate in compression mode, is when you need to achieve primary bone healing. So when you need to achieve bone healing that is pretty much perfectly anatomical. And the requirements for primary bone healing are anatomical reduction, interfragmentary compression, and absolute rigidity. And this plate helps achieve the absolute rigidity and, most importantly, the interfragmentary compression, and it also maintains the anatomical reduction. And the way it's achieved is quite interesting. So you've basically got a fracture and clusters of screws on both sides of the fracture. And what happens is you screw the screws in on one side, and then on this side there's a hole for the screw, and you place the screw a little bit closer to the fracture than rather than in the middle of the hole, and then the base of the screw tightens against the plate and it causes compression of the fracture site. And then you do it for the second screw and that does it even more. And that is how you achieve a plate in compression mode, and that's that. Then we can talk about plate mode number 2, which was in the thumbnail. And guys, I always deliver on my thumbnails. I never leave you hanging with it. If it's in the thumbnail, it's in the video. And that is a neutralization plate. So a neutralization plate is one where you have a primary fracture fixation device, which in this circumstance is this screw right here. And you have a plate going across as well. So this is an AP radiograph or a PA radiograph of someone's left ankle, and there's a Weber B fracture that has been fixed with a screw in lag mode and a neutralization plate. What it basically does is you've got this fracture and an oblique fracture with a screw going through the fracture site, and it's in lag mode, which means that the screw actually pulls the distal fragment towards the proximal fragment, or rather it pulls the far cortex towards the near cortex. But that's vulnerable to shear forces, because if you imagine load going through here and the fracture is oblique, then that's going to cause a lot of shear force and it can cause construct failure. So basically this plate has screws on either side of the primary fixation device, and that helps share the load. And the use case is where you want to share the load between the neutralization plate and a primary fixation device. and it's achieved by having the primary fixation device at the fracture site and then putting the plate over the same fracture site with screws in healthy bone on both sides of the fracture. And that's neutralization mode plating. Then we can talk about plating in bridging mode. So here you've got a PA radiograph of someone's right ankle, and you can see that there is a comminuted fracture in the sort of distal 1/3 of the diaphysis of the tibia. There's also a fibular fracture. So the effect of a bridging plate comes sort of from the name of the mode itself. So if you imagine land here, and water here, and this is the bridge in between. So the effect is basically allowing for this massive comminuted fracture to stay undisturbed while keeping the proximal and distal bone on the healthy bone proximally and distally at sort of a constant length, and allowing this to be just held together by the periosteum. And the use case of that is comminuted diaphyseal fractures where there's healthy bone on either side. And the way it's achieved is you put a plate across the comminuted fracture, and the plate has to extend from healthy bone proximally to healthy bone distally, and you put screws into the healthy bone. And that's a bridging mode plate. Then we've got a plate in buttress mode. This picture actually shows two different plates in buttress mode. So this is an AP radiograph of someone's right elbow, and we can tell that it's the right elbow because here we've got the head of radius and the radial tuberosity. So this has to be the lateral side, so therefore that's the right elbow. And the effect of a buttress plate is basically to keep metaphyseal fragments from moving away. And the use case is usually metaphyseal or epiphyseal fractures, and it's often used in fractures with a intra-articular component as well. So for example, this is like here we've got a distal humerus fracture, or you could use it in, for example, a tibial plateau fracture. And the way this is achieved is you've seen a lot of the plates so far being used so that the fracture is in the middle of the plate. So you've got healthy bone, fracture, healthy bone. In a buttress plate, you've actually got healthy diaphyseal bone here, and then you've got the metaphyseal fractured bone, and the whole distal end of the plate, well in this case it's distal and sometimes it can be proximal, but this end of the plate is at the fracture site completely, so it doesn't cross over into healthy bone, and that's basically how it works. So you've got screws in the healthy diaphyseal bone here, and this is probably starting to be metaphysis there, and then the plate mimics the shape of the bone that it should be. So here it mimics the shape of the lateral epicondyle of humerus. Is it condyle or epicondyle? I can't quite remember. But anyway, it mimics the shape of the bone, and it goes into the metaphysis, and then you put a bunch of screws in. And this can be combined with screws in lag mode or simple screws. And here it's also been combined with some Kirschen wires, it seems, and looks like there's a tension band wire in the olecranon as well. So that's a buttress mode plate. Then we need to talk about the tension band plate. So I think this X-ray shows a plate in tension band mode, but I'm not 100% sure because it would depend on how it was applied, because it could also be a compression mode plate. But we're just going to go with a tension band plate here. So the effect of when you've got a long bone, there's usually a compression side and a tension side. So if you imagine the mechanical axis of the leg going through here and load going through there, that means that the center of the load is here, which means that the medial cortex of the fibula is being compressed, but the lateral cortex is in tension. And this also happens with the femur. So where you've got a slightly curved long bone, the side that is more convex and it's on the outside is the tension side. So this is compressed and this is under tension. And the effect is basically taking over the role of the tension side of the bone and converting the entire bone into a compression. Okay, so this is all under compression. The lateral cortex, the lateral cortex and the medial cortex, and the plate is under tension. Use case is basically just transverse diaphyseal fractures where you can accept secondary bone healing. So if you've got a transverse diaphyseal fracture where you want primary bone healing, then you probably want a compression mode plate. But if you can accept secondary bone healing, then you can use a tension band plate, which may be simpler to apply. The way that it's achieved is you basically just put a plate on the tension side of the bone. You just need to know which side of the bone is the tension side, put the plate there, and you don't put it in compression mode. And that's how you make a tension band plate. Now we need to talk about the dynamic hip screw. So it has a plate, but it's not in any of the modes. Okay, so a dynamic hip screw, there's a screw here that goes into the neck of femur and into the head of femur, and there's a plate here with an angle. This is usually 135 degrees, and this is a 2-hole DHS. The effect of a DHS is basically you've got someone walking and it causes load this way, and the angle stabilization device converts it into a force vector that goes in this direction, and it causes compression at the fracture site here. Use case is for intertrochanteric fractures of neck of femur where there's not too much instability or comminution. And why is this not in any of the modes of plating? Because the plate itself does not cross the fracture site, and in a DHS, if the fracture is basically not allowed to touch the plate. So yes, there's a plate because there's a sheet of metal with holes and screws going through it, but it's not in any of the modes of plating because it's not the plate itself is not a primary sort of fracture fixation device. It's just there to hold the angle stabilizing device together so that the dynamic hip screw can do its job. So that is basically the video on modes of plating. We've gone through compression plates, neutralization plates, bridging plates, buttress plates, and tension band plates. And my name's Arrow. I'm a doctor in the UK. I make videos about sort of surgery and orthopedics and anatomy and those sort of things. Medical education videos with good serious content, and I try to keep it interesting and light. So if you like this video and you want more videos like this in your feed, then please subscribe to my YouTube channel. And if you think someone else might benefit from this video, then please share it. I'm trying to make a little bit more orthopedics related videos, at least for the next couple of months. Thank you for watching. Bye bye.